have recently had surgery or about to go through surgery, so we have put this information together to help. In the following presentation, you will see real patients changing and emptying their stoma bags to give you an insight of what's involved.
My name's Irene Loma and I've had my stoma nearly 11 years.
My name is Melvin Demon and I've had the stoma for approximately 3 months.
I had chronic cystitis and I had no feelings when I wanted to go to the bathroom. And when I was going to the bathroom, I had no feelings when I wanted to stop or when I finished going to the bathroom.
I was diagnosed with cancer of the bladder and of the prostate, which resulted 3 months ago of having my left kidney removed, the bladder, the prostate and the uvula was rerouted to the right kidney.
I seen this red thing coming out my stomach and I thought I'll never get used to this, never.
And there was a tube that was laying on the top of it, which was explained to me was a stent, which would be removed after about 10 days.
And it was a shock, but gradually, with the nurse's help and just talking to people and talking to other urostomies, you get your mind round it.
But with the help of the stoma nurses and the doctors and the ordinary nurses in the intensive care, they explained what it was, how it worked and all the rest of it, and that helped me greatly.
This is a procedure that will need to be done frequently during the day when the bag is a third to half full. This can be dependent on the amount you drink. Additional capacity can be obtained by using a leg bag. At night, many patients find it easier to attach a night drainage bag, which will collect up to 2 litres overnight, giving less disturbed sleep. There are many different types of night drainage bags and connectors which your stoma care nurse will advise you on.
I empty my bag when I feel it getting a bit heavy.
I worked it out at an average around about every 2.5 to 3 hours, depending what I'm drinking, because I drink a lot of water.
At first, when I had my bag every 10-15 minutes, I was running up and emptying it, but you don't have to do that. You just get so used to, you get the feeling, when it's due to be emptied, and you just go and empty it.
Now we are going to show you a bag being changed. This will need to be done every 1 to 3 days. Empty the bag first. The hole cut in the flange should fit closely around stoma. This should be checked at regular intervals. You will need to think carefully and logically about what you are going to do. When you take off the bag, you're going to need to put it into a disposal bag, so get that ready.
The first thing I do in the morning when I get up, before I do anything else, I lay the equipment out, what I need to change the bag, and that's before even having a drink or anything.
You will need to change it quickly as urine will dribble constantly and the skin can get wet. But don't worry, practice makes perfect, and in time you get quicker. As long as it is empty and sealed, it is safe to dispose of in your normal household waste. Some patients experience reddening of the skin on removal of the bag. This is not unusual and will quickly disappear. Stomas are as individual as the people who have them. Don't worry if yours does not look like this, as long as it's pink and functional. It's not unusual to have a bit of blood from the edge of the stoma. Should you encounter any problems with the care of your stoma, seek advice from your stoma care nurse, who will advise you of the additional products to help. A two-piece system consists of a base plate or flange and a bag. These connect in a variety of ways, which your stoma care nurse will demonstrate. The advantages of a two-piece system are the different bag sizes you can use. Another advantage of a two-piece is the base plate can be left in place for up to 3 days, and bags changed as necessary. The removal and cleaning process for a two-piece system is the same as for a one-piece. However, the application process is slightly different, and it is done in 2 stages.
Put my base plate on, making sure it's on securely. Then I put my bag on top and then just clip my bag and off I go. Not made any difference whatsoever. I still wear a bikini, we go on holiday and no one knows. Still have the same lifestyle. In fact, I have a better lifestyle with urostomy.
We have now shown you how to empty your bag, which will need to be done regularly during the day, and how to connect to a leg bag and night drainage bag, which will give you extra capacity when required. We have also shown you how to change a stoma bag, which will need to be done every 1 to 3 days, depending on your personal preference.
One of the things that does throw me sometimes is the mucus that comes out, and it's quite a lot of it. And it's been explained to me that will be like that for some time. Because I'm a diabetic, I have to be very careful with my diet. And cranberry juice, I do drink it, but I have to restrict how much I take because of the diabetes. I normally drink fresh orange, lemon, that sort of cordial drinks, and I find that works. And I've also noticed that when I'm drinking these things, there's not quite so much mucus coming out from the stoma.
Sometimes there's a smell of the mucus, but you get that used to it, you just do it. It's part of your routine, it's part of your life, and you just get on with it. I eat cranberries. I discovered that if you put cranberries and nuts into a salad, it's really tasty, and I eat a lot of cranberries because of infections. I've heard it helps with infections, and I try and drink a lot of water. The stoma nurses were fantastic. They just took their time and gradually getting me used to changing a bag and just looking at the stoma, getting me used to looking at it.
Well, I do ring the stoma nurses and I find them very, very helpful. Socially, I haven't been out much since it because I'm getting over the operation. Even now, after 3 months, I'm still getting over it, and I do get very tired. Myself and my girlfriend, we have a relationship which is sexual, but unfortunately at the moment I can't achieve an erection because of the operation. I was warned by the consultants that this would happen, that I would be impotent, but there are things they can do in the next few months that will hopefully rectify that. But I've got a very, very good girlfriend who's very supportive, so in that respect, though life is a little bit more difficult than it was, we're happy together.
I say for the first 3 to 6 months it's very hard to get your mind round the urostomy and to get yourself sorted out with your bags. But once you get yourself sorted out, life goes on, and I'm living proof of that. Quite happy.
Initially, you will have a narrow plastic tube, stent, protruding from your stoma, 1 per kidney. These are temporary. Your stoma care nurse will explain these further. From time to time, you will be asked to produce a urine specimen. Please discuss with your stoma care nurse the best way to collect this. Hopefully, seeing it done by real patients with real stomas has given you some confidence that it is straightforward. It may be daunting at first, but in time you will become the expert. Should you experience any problems, please be assured there is advice and help from your stoma care nurse, the various patient support groups and company helplines.